Diabetes Type 2 by Emery, DeLacy, and Rayleigh. What is type 2 diabetes? It is also known as diabetes mellitus. Type 2 diabetes is one of the two major types of diabetes. This type, in which the beta cells of the pancreas produce insulin, but the body is unable to use it effectively because the cells of the body are resistant to the action of insulin. Although this type of diabetes may not carry the same risk of death from ketoacidosis, it otherwise involves many of the same risks and complications as type 1 diabetes. This type of diabetes exhibits insulin insensitivity, unlike type 1, meaning type 2 does not react to insulin in the same way. Name origin: diabetes mellitus. Diabetes mellitus is derived from the Greek word diabetes, meaning siphon, to pass through, and the Latin word mellitus, meaning honeyed or sweet. This is because with diabetes, excess sugar is found in the blood as well as the urine. In the 17th century, diabetes was known as the pissing evil. The term diabetes was probably coined by Alponus of Memphis around 250 BC. Diabetes is first recorded in English in the form diabetes in a medical text written around 1425. It was in 1675 that Thomas Willis added the word mellitus to the word diabetes. This was because of the sweet taste of the urine. Discoverer Harold Hemsworth, distinguishing between the two types of diabetes in 1936. He discovered that type 2 diabetes doesn't respond to insulin or make enough insulin the way it should. The date of discovery. Harold Hemsworth made the remarkable discovery in 1935 that there were, in fact, two different types of diabetes. Those which were sensitive to insulin, which is type 1, and those that were not, which is type 2. This breakthrough was finally made possible by the relatively recent discovery of insulin in 1921, and presumably came about when the doctors noticed that insulin injections were having less of an effect on some diabetes patients. In the 1950s, a new medication was developed that is considered to be the beginnings of the history of type 2 diabetes treatments. Before now, there was no history of type 2 diabetes treatment whatsoever, so those with type 2 had to make do with simply using more insulin in hopes that their cells would absorb enough. The cause. The exact cause of type 2 diabetes is unknown. However, there does seem to be a genetic factor, which causes it to run in families. Although it is possible for a person to inherit the tendency to develop type 2 diabetes, but it usually will take another factor such as obesity to bring on the disease. Diagnosis criteria. In order to diagnose type 2 diabetes, diagnostic tests are used, such as lab tests, imaging, urine sugar test, blood glucose test, and the fasting plasma glucose test. The main test used for diagnosis is the glycated hemoglobin, or ACI test. This test will indicate the average blood sugar level for the past 2 to 3 months for the tested individual. Normal levels are below 5.7. The impaired fasting glucose level, or pre-diabetic level, falls between the range 5.7 and 6.4, and if your blood sugar level is higher than 6.5, unfortunately, you have diabetes. The body systems affected. Type 2 diabetes affects many organs, such as your heart, blood vessels, nerves, eyes, and kidneys, as well as increases the risk of other complications. If you have heart and blood vessel disease, diabetes drastically increases the risk of heart disease, stroke, high blood pressure, and narrowing of blood vessels. Nerve damage is also possible with type 2 diabetes. Too much sugar can cause tingling, numbness, burning, or pain that usually begins in the toes or fingers and gradually spreads upwards. You may eventually lose all sense of feeling. Kidney damage is also possible, which will also sometimes lead to kidney failure. Other areas of the body that type 2 diabetes affects is your eye, creating damage. It prohibits proper healing of cuts and blisters. It may cause hearing impairment, skin conditions, sleep apnea, and can increase the risk of Alzheimer's disease. The population most affected. Type 2 diabetes used to be known as adult onset diabetes, but today more children are being diagnosed with the disorder. There are also certain races that are more likely to develop type 2 diabetes. These These races are Black, Hispanic, American Indian, and Asian American people. Type 2 diabetes also affects the older population, more specifically after the age of 45. This has to do with less activity, loss of muscle mass, and weight gain as they age. But as stated above, it is increasingly drastically among children, adolescents, and young adults. Available tests. Type 2 diabetes can be diagnosed using the glycated hemoglobin test. This is a blood test that indicates your average blood sugar level for the past 2 to 3 months. If this test isn't available, these other tests may be used. Random blood sugar test, fasting blood sugar test, or the oral glucose tolerance test. Available treatments. Currently, there are no available treatments for diabetes. Type 2 diabetes can be controlled by a healthy diet and exercise. In some cases, lifestyle change is not enough and medications can be prescribed to help control diabetes, but diabetes is not curable. Preventative strategies. Healthy lifestyle choices can help prevent type 2 diabetes. This includes eating healthy foods, getting active, losing weight, and avoiding being sedentary for long periods. Sometimes there is medication that is an option as well, but even with taking medication, a healthy lifestyle is essential to prevent or manage diabetes. What are the risks? You could be at risk if you are 45 years or older, if you have family, a parent, sister, or brother with diabetes, if your ethnicity is African American, Alaska Native, Native American, Asian American, Hispanic, Latino, or Pacific Islander American, if you have heart and blood vessel disease, if you have high blood pressure, even if it's treated and under control, low HDL cholesterol. You could be at risk if your triglycerides are high, if you're overweight or obese, if you had a baby that weighed more than 9 pounds, if you had gestational diabetes while you were pregnant, if you have polycystic ovary syndrome, if you have acanthosis nigricans, which is a skin condition with dark rashes around your neck or armpits, and if you have depression. Also, there are some modifiable risks known as the metabolic syndrome, which are abdominal obesity, elevated blood sugar, elevated blood glucose, and unhealthful levels of certain blood lipids. Dietary restrictions. Avoid these 3 white foods if you have type 2 diabetes. They are sugar, salt, and white flour. These 3 foods are harmful to everyone, but especially those with type 2 diabetes. Stay away from sugar. There is a strong relationship between sugar and the development and progression of diabetes. Sugar has a high glycemic index. Avoid products that contain sugar, like sweets, honeys, syrup, jelly, ice cream, and cake. Stay away from fried foods. You want to bake, broil, or grill your foods instead of frying them. The added fat content, cholesterol, and carcinogens can worsen some of the complications of diabetes. Stay away from sauces and salad dressings. They are often high in sodium, and because of the large percentage of type 2 diabetics will only develop hypertension in their life, it is important to avoid these condiments. You'll want to stay away from cheese and dairy products, which they are full of fat. These products contain high levels of saturated fat. Saturated fat makes your insulin less sensitive. Furthermore, the excess calories that these products provide will only help you gain weight, which doesn't help treat diabetes. Instead, go for low-fat and skim versions of these products. Stay away from refined flour. Refined flour is a very simple form of carbohydrate. It is stripped away of its essential nutrients and can enter the bloodstream in similar ways that sugar does. Avoid these foods, which are found in a lot in baked goods and breads. Read labels and go for products created from whole wheat flour.